I think we're seeing a lot of landscape shifts in multiple myeloma right now. I can't really pinpoint one that's most significant, but I think some of the ones that stick out in my mind are the shift in our induction regimens, so moving the monoclonal antibodies and the second generation proteasome inhibitors like carfilzomib into that induction regimen space where those were typically being reserved for relapse myeloma. I think that these newer therapies and having more of a pipeline and more kind of tools in our belt is changing the landscape. And then the last two things that stick out to me that I think is more to come that we haven't seen yet is the concept of minimal residual disease testing. So MRD testing has been a hot topic lately, and I think we don't know exactly how to use it yet to guide treatment, but I think that we may be seeing that in the future. And then additionally, our smoldering multiple myeloma patients are starting to be treated differently. So those high-risk smoldering myeloma patients or those with 2 of the 2220 criteria, a lot of them are being either put on clinical trials with daratumumab and lenalidomide, or they're being started on lenalidomide off trial. So if those patients do ultimately convert to symptomatic myeloma, we're going to have to treat them differently. So I think there's a lot of landscape shifts, but those are some big ones that stand out in my mind.
I think the option of more medications in multiple myeloma has totally changed the game. So back when you think about even 15 years ago, there are 22 new drugs out on the market for multiple myeloma. So I think being able to offer patients options is really the biggest thing. So what is most important to you in your quality of life? Is it being able to stay at home and receive treatment and deal possibly with more side effects? Is it coming in for an infusion once a month and then, not having to deal or think about with multiple myeloma every single day? So I think all of those factors that the new medications that have been FDA approved are providing patients with has really changed even just the morale with multiple myeloma, and has also led to deeper, more durable responses and even significant changes in overall survival.
Now, I think you both make really good points, and these newer drugs are very tolerable, but it's really exciting what we're doing on clinical trials. And with conjugated antibodies, with CAR T, everybody who's coming through the door is asking us about CAR T trials, and I think it'll be interesting to see what we do with those in the future. Right now it's in that relapse refractory setting, but how does it change our therapy and our algorithms if we move that further up? And then I think the other exciting thing is looking at sequencing and looking at how we're doing precision medicine, that we're looking at the genome and we're looking for those other clone types to choose treatments. We have clinical trials that are doing that in the early relapse setting. So I think it's very exciting.
One other thing that I think it's important to note is that the overall survival of multiple myeloma patients continues to get better and better. And I think that is so encouraging for patients to know and to kind of reassure them that we're making progress every single year and every single day.